Dr. Porter, and I'm live on Saturday with Ashley, who's one of my great models. She actually was a model, so she does great, and she's really very tough to do filler and injections, and she doesn't even flinch. So she won a Vampire Facelift today, and that's what I'm going to do. So I have some filler, and I have some platelet-rich plasma, which we took from her blood. We spun it down, we turned it into this stuff that looks like pee. But it has lots of awesome growth factors in here, and we're going to inject it into specific places to add color, to help with the texture. The darkening helps a lot underneath the tear troughs, and just the hyaluronic acid, which this is Juvederm Ultra Plus, it works as a scaffolding for the PRP to help keep it kind of where it goes, and it activates it. So specifically, we're going to address her cheek. She likes her cheek to be a little less flat right here. And then we're going to put some PRP underneath her tear trough. So tear troughs are tricky when you do filler. They sometimes swell, and sometimes people end up looking puffier than what they were. It depends on the injector, it depends on what filler you're using. But even if it's done really, really well, some people end up not liking the way it looks. So I've been doing a lot more is actually just injecting PRP into the tear troughs. We do usually 3 treatments about a month apart. We would use more than what I'm going to do in the Vampire Facelift, but it's very painless, and you get immediate effects actually. So the area fills up, and you never look overdone, you never look puffy, and then it works to darken the dark circles underneath there, and then some of the wrinkles. It works really well on people of color when they have the really dark circles underneath there. So like people of Indian descent or Bangladeshi, that works great too. So anyway, I'm going to demonstrate a little bit of what we're going to do for the Vampire Facelift. Small. I'm going to use 1 syringe for the whole thing, which is amazing because, you know, a lot of people, they use so much filler, and you really don't need that much. If you put it exactly in the spots that you want, you can do it with very little product and still get a really nice outcome. And the cool thing about Vampire Facelift is putting under the cheek is it actually helps support the tear trough too. Without putting volume in the tear trough, you're helping support the tear trough. So I just put the filler in there. And then normally what I would do is I would go into the other side, and I kind of do all the filler first, and then I go and add the PRP. But just to show you what I'm going to do, I'm actually going to go and put the filler right back in, or the PRP right back in here. And it's the same spot I'm going to use. And this way you never look overdone, which is what's so cool about it. I think that so many places, they end up putting so much product in your face that you look overdone, and then everybody can kind of notice. So I went right in here on her cheek and put a little bit of filler and a little bit of PRP. And then, so that's that side. You already look less flat, girl.
Mm-hmm.
Do you guys see that?
I can feel it.
Can you notice that difference? So right here, she's less flat than what she is right here. Let me show you so you can see. And I hardly use any filler at all. Do you see that?
Oh yeah, I love that.
Yeah,
it gives
so
me
subtle.
my volume back here.
Yeah, but
it's subtle, but you can see a big difference. It gives me my fullness here.
Yeah, and the cool thing, Ashley's a hairstylist.
Oh, this is not dirt.
It's not. So, but she did touch her face, so I am gonna use some. We want to make sure we're really, really clean when we put filler in the face, so we don't get infection. But yeah, she's not a chimney sweep. She's a hairstylist, so she was doing some balayage or something today, huh? Mm-hmm. So that was that, and then we're gonna. I'm gonna put a little bit here under her tear trough too, and you can see how this fills, and it looks so amazing, and it really doesn't hurt.
Mm-mm.
One little bit here, a little bleb, and then I'll do another little bleb right here. I'll smooth that out, and you guys will get to see what that looks like. So let's kind of rock it there. And the cool thing about the Vampire Facelift is you get very subtle, immediate results. You know, the difference between a supermodel and me is a millimeter here and there, and that's about it. So subtle changes can make a huge difference, and you still look like yourself, but then the results you really get come 2 to 3 months later when the PRP has kind of done its thing and has activated the stem cells and started to regenerate the tissue. So look at that, Ashley. Look at your difference in your tear troughs.
Oh, yes. Wow. Yeah.
But not puffy.
Yeah.
And so I like to do this first, and then I say, look, live with that for like a couple weeks, and then we'll come back, and if we did need to address or add any more volume. If I were just going to do your tear trough, I would use quite a bit more than what I used just for this treatment. But so that's a little glimpse into the Vampire Facelift, and I do lots of these. I train other physicians around the world on this procedure too. It's very popular, and it really works well. It's a great introductory treatment to make sure that you look like a better version of yourself, but you're not going to look overdone in any way. So if you have any questions or you want to come on in, give us a call.